I would like to introduce our first projected clinic, who is no stranger to the Academy. Dr. Tom Colquitt graduated from Baylor College of Dentistry in 1970. Tom has been an Academy member since 1983, was one of the founding committee members of Through the Eyes of the Master video series, and served on the Academy as president in 2005. He's also served as president of the International Academy of Nathology, the Southwest Academy of Restorative Dentistry. Tom is an adjunct professor in the Department of Sleep Medicine at LSU Medical School in Shreveport, Louisiana. He currently divides his private practice time between traditional restorative dentistry and the management of sleep-disordered breathing. Presenting I Can't Breathe, My Personal Journey from Chronic Inflammatory Disease to Wellness. Please help me welcome Dr. Tom Colquitt to the podium.
Thank you, Dave. This is my honorarium. This is the narcissist's dream. 18 minutes to talk about yourself to a captive audience. But I did not ask for this. President Herrera assigned me this, so you're going to have to blame him. I've been coming here since 1970, for the last 30-some-odd years as a member, and I have to say that I have never anticipated any meeting in this academy as much as this one, because I really feel thrilled to be part of what I feel is an ongoing quest. Let me see if this thing works. And this is for Jeff Rouse. He said, I know you want to save the world, but you've only got 18 minutes. But you're going to hear messages. Yesterday you heard from David Gozal and you heard from Mark Cruz, and there will be many of us today. And we are on a quest to save us from self-extinction through multidisciplinary collaboration, one nasodiaphragmatic breath at a time. The infant's tongue, I believe, left to its own natural devices, will conduct the proper growth of the structures of the middle and lower face, including the nasal capsule, and then, for a lifetime, will conduct the multiple operations required to fulfill the nutritive and air conditioning needs of the entire human organism, if that's possible. Because we've got to remember that the face, you look at this cross-section, it looks like a jello in a mold. Remember that except for the mandible, all of those structures, the mold is grown by the jello because it's intramembranous bone. The brain grows our cranium. The eyes grow most of the orbits, and the tongue grows everything down to the mandible, along with what we heard yesterday, mechanotransduction from proper masticatory function, if everything works correctly. My tongue never achieved its genetically prescribed goal, and the result is I've been sick since the day I was born until recently. I'm the poster boy for the continuum of disordered breathing, not even considering sleep-disordered breathing. These are the confessions of a recovering mouth breather. And for the last 20 years or so, I've been involved in what was called dental sleep medicine, which were treating sleep-disordered breathing. I've been on the faculty at the medical school in Shreveport in sleep medicine for 9 years, toyed with the American Dental Academy of Dental Sleep Medicine, and what we were looking at was management strategies for obstructive sleep apnea, an end-stage condition. But now I've come to understand through great teachers in this room that sleep-disordered breathing is a misnomer. What it really is breathing disordered sleep. We have people who can't breathe. They can't breathe 24 hours a day. It's just worse at night because of gravity and atonia. So understanding how we breathe explains what happens when we can't breathe, and our focus must be to promote functional breathing all the time. So this is my personal journey from chronic inflammatory disease into wellness. It's a case history over 70 years. There I am, 1946. I've already got facial asymmetry. My mouth is open, my nose is swollen, my eyes are asymmetric. The stuff is running out of my nose and my mouth because I can't breathe, and I'm less than a year old. I already had allergies. Here's a photograph of a child with obstructive sleep apnea, the position they're in trying to breathe. Here's me trying to breathe. And here's my face. I look like I just sneezed. That's a sick baby. And I couldn't find any pictures of me as a child with my mouth closed. So we got to deal with genetic and epigenetic factors. And if you look at my parents and profile with me, I was doomed to have a big forehead and underdeveloped lower face. That's genetic. And if you develop that underdeveloped lower face as a child, when you get old, you may look like that. That's the reason she never smiled, I believe. Whistler's mom couldn't breathe. And by this time, I'd already had chronic sore throat and had my tonsils and adenoids out. And here, a few years later, I've got eczema. I have chronic sinus infections. I've got to go get my sinuses pumped out every week. I'm on daily antihistamines, and I'm already developing this posture to compensate for a poor airway. Finally, at age 11 is when I got obese and stayed obese for 56 years. Here I am in prep school. I lost a little weight there because the solution was, let's put them on Dexedrine. And so I was addicted to Dexedrine for a long time to try to control my appetite, which was a result of hormonal misbalance from dysfunctional breathing. During those years in high school, that's typical adolescent years, I ended up breaking a couple of fingers playing soccer, and to rehabilitate those fingers, I learned to play the guitar, and that became my lifetime love. And by the time this period here, my senior year in high school, I graduated at 250 pounds. After my first year in college, I weighed 300 pounds. And I managed to diet myself down with Dexedrine to about 232 when I was 19, and we had our first successful band. And then I went to dental school, and I met the best thing that ever happened to me. You all know Ginger. As soon as I met her, I started getting fat again. I had her in the bag. Didn't have to. There I am on my wedding day with my best friend behind me, who is now dying from Lewy body dementia because he's never been able to breathe. And if I'd known 40 years ago what his problem was, he wouldn't be dying right now. Went into practice with my father. We started having babies. And here we are in Florida on a family trip with our second child. And I look kind of skinny there. That's because I got Crohn's disease now, diagnosed by a string sign right there. And that's caused by improper functioning of carbon dioxide through overbreathing through your mouth. But nobody knew that. So I've lost some weight, but look at that posture. If you see this posture, and I have to fight it all day long now, that's somebody who can't breathe. Look at that head forward posture. That shows somebody hadn't got a patent airway, they're trying to compensate for it. So during these years, I really started getting sick, 2 DVTs, had a foot of my gut cut out, had all kinds of skin problems. And if you cut out your gut, you can lose a lot of weight, and you may end up being able to play the guitar on the Delta Queen and play with B.B. King and have him autograph your guitar, but I was still sick. I just almost died right before that trip. Got over that symptomatic treatment, started getting fat again. Still couldn't breathe. Now look at that. That's my presidential year. That was going to be my hobby slide. Look at that posture. Some of you may remember Dr. Carnahan Muir. That's the year I was a president, and to me that looks like a sick man sitting next to Dr. Carnahan. During these years, I had 2 rectal fissurotomies that almost killed me. I had a stroke in my right temporal lobe, I almost retired, and I was diagnosed with ventricular cardiomyopathy. So I'm going to run through this as fast as I can, but yesterday we were talking about the continuum of chronic inflammatory disease related to poor breathing. I'm the poster boy. Wasn't breastfed, ate pureed baby food, allergic as a child, chronic sinus infections, daily antihistamines at age 5, began a journey to 300 pounds at age 8, anxiety, depression, suicidal thoughts. I was a miserable kid. Acute kidney disease, hit 300 pounds at age 18, Crohn's disease at 29, 2 DVTs, hospitalization, 2 rectal fissurotomies, hypertension, cardiomyopathy. I was on the list for a heart transplant, ejection fraction in the 20s, Cheyne-Stokes breathing, a stroke in the 1990s, 3 failed cardioversions, my AV node ablated, 2 pacemaker defibrillators over 8 years, persistent abdominal tenderness from Crohn's disease, trouble maintaining my weight, TMD, headaches, joint noises, multiple equilibrations, and all kinds of terrible skin problems. If you haven't had a pyoderma gangrenosa, you don't want one. It's as pretty as it sounds. So that was my health history. This is not a pretty story. In 2013, I heard Mark Cruz at his first course. And I realized I'm that guy. I'm the one. I can't breathe. That's why I'm sick. My health issues are because I never learned to use my tongue. I never developed an airway, never learned how to use it. And I heard Ted Belfort talking about how he could develop airways and faces with Homeoblocks. I thought it was a crock. It's preposterous. As Jeff Rouse says, how's a hunk of acrylic going to help you? No way. Or is there a way? Maybe we shouldn't indulge in contempt before investigation. So I wore these things. I wish I could talk about what they do. I'm short on time. Primarily, they do what the tongue never did do, and those bite blocks do mechanotransduction, which we heard about yesterday, which is not only the mechanism that maintains bone, it's the mechanism that grows bone. So if you have young kids who never learn to breathe, never learn to swallow, never learn to chew, they can't grow a face. They can't grow an airway. So it's time to get proactive. I'm going to wear my Homeoblocks every night. I'm going to tape my mouth shut so I have to breathe through my nose so that my tongue will begin to come up and out of my throat. I'm going to advance them. I tried to standardize this, so an orthodontic colleague took photographs every 3 months. We took serial diagnostic casts. During the daytime, I worked on trying to get my tongue in the right position, try to breathe through my nose, tried to work on my posture, which is harder than hell to do. If you spend 70 years compensating, it's hard to change. I expected a little, but hoped for the best, and we made ICATs before and after treatment. So at night, this is a selfie, got my mouth taped shut, got my Homeoblocks in, and I've got Breathe Right strips to initially expand my nares, so I had a patent nasal breathing tube. And during the daytime, I tried to stand up straight. This is one of my exercises. It's the full Guinness. This is a half Guinness. And if you do that, if you're used to walking like that, it'll make you stand up straight. So eventually, as you learn to breathe better, you may learn to overcome your lifetime compensations. So here's this ICAT of my sick and tired old head. If you look at that green line that Mark showed yesterday, that should be 97 millimeters. I'm a centimeter undeveloped there. I got a low tongue posture. There's a big gap there, and that's the site of the obstruction, if there is one. So this is a study. We took the photographs. This is an article that shows that kids who have these problems, if you look at the green areas, those are the areas of their faces that are underdeveloped. And so what I did was take the photographs, use the same anatomic markers before and after, and put it through a morphing software. And this will give you an idea of how the morphing software does. It'll also show you what aging will do for you. Dave just showed my old picture for the Academy from 12 years ago, and here's what 12 years of aging will do to you. Now, I had hoped that this is what would happen. Hope for the best, expect little. Here's what actually did happen. I want to show you a year and a half of aging made with the same photograph by the same technician with the same lighting at 18 months apart. Now what I see is a sick old man getting better looking and happier looking, and look at the eyes. If you want to see if one of your patients is sick, look at their eyes. And what you're seeing is I'm having a whole lot of bony development going on in my face at age 70. If you look at it from the side, it's not as obvious, but you can see my right sphenoid developing, which I did not expect. I grew a wider basocranium. If you look at, here's my galloping ICAT. Now watch the changes. I start out with my tongue down low, with my mouth open. As my tongue comes up, my palate grows down to meet my tongue. My airway begins to open, and if you look up in the frontal sinus area, all of that gets bigger. So by wearing an appliance in my mouth and biting on it all night long, I grew structures up in here. I did not think this could be done. I was astounded. I call this growing a linguatorium. The tongue is supposed to conduct all of these things, and it needs an auditorium in which to perform. So here's what happened to my upper arch. You can see the palate growing down. You can see the teeth going along for a ride as bone grows. This is not orthodontics. You can see my lower tongue space developing. My mandible grew way forward on the left side. And here are overlays of ICATs made before and after. The green is what I started with. The red is where I grew new bone. Especially around the maxilla, because we got to remember, most of the nose is the maxilla. Interestingly, I'd had a history of TMD problems on the left side with multiple equilibrations, pain, clicking, and locking. And if you look, the red shows actual remodeling of the condyle and the eminence and centering of the disc. And I no longer have any joint noises, clicking, or discomfort anymore. These were all unexpected. So here's what's happened since 2014. I went from 242 to 198 pounds with no dieting. I think it's because leptin and ghrelin and cortisol are now under control. My second pacemaker is holding me at 70, but my pulse stays in the 60s. I've gone off my antihypertensive meds about 75%, and I run at about 117/75. I don't take diuretics anymore. I've had abdominal tenderness from 40 years from Crohn's disease. It's gone. My TMD issues resolved themselves. I quit taking Paxil for depression and anxiety after 25 years. If you read Avram Gold's work on UARS, anxiety and depression, it will help explain that. Terrible chronic skin problems that have almost put me out of business have almost completely healed. I don't have GERD anymore. I quit taking proton pump inhibitors. I'm now a daytime habitual nasal breather. I can sleep well with only my mouth taped. My ejection fraction is still not great because once you've damaged your heart, it stays damaged. I feel as well as any old fart should. I no longer feel like I'm circling the drain on a daily basis. And I feel fortunate to be part of this quest. So my anecdotal conclusion, having lived it myself, is that it is possible to grow a functioning airway and train a patient to use it. And the patient's health may make a turn for the better. In short, it's all about your tongue and your nose. And if you don't want to die in your sleep, change what you do during the day. Thank you for your time.